Today, we will discuss fistula in women. Fistula in women, otherwise called vaginal fistula, is a hole or opening in the vagina that allows leaky urine or gas passage or stool through the vagina. This is as a result of childbirth injuries or surgical complications or infections or diverticulitis or what we call fecal impaction. When we're talking about fecal impaction, we're talking about that in some times, especially in elderly, there is stocking of fecal matter or stool in the rectum, which is the lower portion or part of the large intestine. All these things can result to vaginal fistula in female. Now, what are the symptoms or signs of vaginal fistula? Some of the signs of vaginal fistula are abdominal pain, diarrhea, vomiting, painful sex, pains, swelling, or irritation in the perineum. When we're talking about perineum, we're talking about the area between the anus and the vagina. Some other symptoms are repeated vaginal infections, repeated urinary tract infections. Immediately you notice some of these signs and symptoms, it is of a necessity that you visit hospital for proper diagnosis or urgent medical assistance. Now, when we want to classify this fistula, we classify them on the basis of the location of the fistula and the organs they affect. One, we can talk about vesico-vaginal fistula. This kind of fistula occur when there is abdominal opening between the urinary bladder and the vagina. It is in the urinary bladder that urine is stored until there is urge to urinate. We can say that vesico-vaginal fistula can also be called bladder fistula. Two, we have a uterovaginal fistula. This occurs when there is abdominal opening or hole between the ureter and the vagina. Ureter is a tube that collects urine from the kidney to the bladder. Three, we have a ureterovaginal fistula. This occurs when there is a hole or abnormal opening between the urethra and the vagina. Urethra is a tube that carries urine away from the body. We can say that ureterovaginal fistula can also be called urethral fistula. We have another one called the rectovaginal fistula. This occurs between the rectum and the vagina. Rectum is a lower portion or part of the large intestine. We also have what we call the colovaginal fistula. This abnormal opening occurs between the colon and the vagina. the last but not the least, we have enterovaginal fistula. This kind of abnormal opening occurs between the small intestine and the vagina. Now, vaginal fistula sounds very nasty. It can only be corrected through fistulotomy. Fistulotomy is one of the surest way we can use to correct vaginal fistula. And this is normally performed by colorectal surgeon. And as the name implies, it is a minor outpatient surgery, not a major surgery. It can be performed, or once it is performed, the patient can go home the same day the operation was carried upon. Therefore, now, if this fistula is not properly treated or handled, it can cause other medical problems called complications. Now, what are the complications of vaginal fistula? When we are talking about some of the complications of vaginal fistula are repeated fistula. We can talk about ongoing pelvic infections or diseases. We can talk about stenosis. When we are talking about stenosis, we are talking about the narrowing of the vagina and the anus or the rectum. We can also talk about difficulty in conceiving or conception, difficulty in getting pregnant. We can also talk about stillbirth. You see the mother losing the baby after 20 weeks of pregnancy. All these things are complications of vaginal fistula. Therefore, immediately you have some of the symptoms I outlined above, you can visit hospital for medical assistance. I remain my humble self, pharmacist Obina Enejere. If this is the first time you are coming across this page, please follow me or follow Farm Obina Talk for more health tips and updates. Bye bye.